Yeah. Welcome, everyone. Today we are looking at how artificial intelligence is moving from science fiction to the standard of care in heart health. We aren't just talking about robots, we're talking about using massive data to catch heart disease years before it causes a heart attack. The the brain of any AI is only as good as the information we feed it. So, in cardiology, we have a unique advantage. We have millions of heartbeats and scans on record. This slide marks our transition into how we turn that raw information into medical intelligence. AI doesn't look at just one thing. It looks at the multimodal landscape. This means it combines your medical history, your heart scans, your electrical ECG signals, and even your Apple Watch data. By connecting these dots, the AI creates like a 360-degree view of the patient that a human doctor simply doesn't have the time to process manually. This is one of the most exciting areas. Usually, a doctor looks at an ECG to see what's happening right now, but AI can look at a normal heartbeat and see tiny invisible patterns that suggest the patient is at risk for a stroke or an AFI in the future. It's like a weather forecaster seeing a storm forming, even when the sky is blue. As you can see by these bars, AI is starting to match or even beat human experts in speed and accuracy. In echocardiology, ultrasounds of the heartbeat, AI can measure how well the heart is pumping with 92% accuracy. The point here isn't to replace doctors, it's to give them like a super tool, so that they can actually spend less time measuring and more time treating. Because this actually automates a lot of the analysis tasks and stuff. Now, when we actually do a cardiac MRI, someone has to like draw lines around the heart chambers to measure them. This is called segmentation. It used to take a human 20 to 30 minutes, but AI can do this in seconds. This allows us to see exactly where heart tissue is scarred or damaged with incredible precision. And this AI in cardiology isn't just a trend, it's an explosion. The market for AI in cardiology is growing at over 30% every year. By 2033, it'll be a nearly $15 billion industry. This matters because it means more funding for research and better tools for hospitals. I mean, patients can get, cured even if they don't have a lot of time because AI can just do things faster. We're moving towards precision medicine. Instead of giving everyone the same dose of a blood thinner, we use AI to look at our DNA to see how you'll actually react to the drug. We're even building digital twins, computer simulations of your specific heart to test a surgery before a surgeon even touches a scalpel. For those interested in the tech, we use different flavors of AI for different jobs. CNNs are like eyes. They like look at images and they can identify patterns in those and stuff. RNNs are like ears. They just listen to heart rhythms over time. Transformers are librarians. These transformers are librarians. They read through thousands of pages of doctor notes. And then obviously we have risk analytics, which actually predict diseases and stuff. And this is our roadmap to AI integration. So from 2015 to 2020, these segmentation and models were developed. From 2021 to 2025, the FDA gave clearance for AI diagnostics. It's actually more official now. From 2026 to 2030, they're gonna actually implement predictive models for care. And after that, they're gonna do digital twins, the heart clone things we were talking about earlier on. This is a breakdown of AI applications. Like 40% of this is obviously going to be diagnosis and imaging. That's where a lot of time can be saved. Uh, uh, it's also predictive analytics, remote monitoring. Drug discovery usually isn't too complex. Doctors can do that as well, but it helps. Anyhow, and these are our next sessions on week 4. We're gonna inform you about the meeting time later on. We might have a collaboration with Next Gen Med. On week 5, we'll have a collaboration with Next.
Sorry I couldn't join, but these will be our next sessions.
Yeah, we'll also have a collaboration with Next about neuroscience. And after that, we'll have an output week again, where you'll have to make an output of your choice, slides, research papers, you know. We'll talk more about that when the time comes. For now, I think we can do the blue kit or something.
Is the booket worth doing if there's only like 3 people here? I thought I joined late too. I was like, oh, I forgot because I was eating dinner actually, and then I realized.
I mean, you can still do it.
Again, so I couldn't make the meeting, but we're definitely gonna have more sessions that will be collaborated